Hi, this is Gary Orris with Lanier Family Healthcare. I'd like to talk to you about a new concept I'd like to offer my patients, primarily the commercial insurance patients at this time, but hopefully the Medicare patients in the near future. Where we are right now with healthcare, of course we've got Obamacare and the disaster it has been so far. I wait to see what Tom Price and Donald Trump do to fix it. But it has made it difficult on the patients. Your rates of premiums have gone through the roof. Deductibles are going up. Denials for procedures, it's been a real nightmare. It's been tough on small practices like myself. They have added an administrative burden that makes it difficult for me to try to succeed to where they will pay me. It's just an extra burden on their part to make it tougher on us. And unfortunately, it's been working. So where do doctors go from here? We can either retire, we can join a larger group. I don't want to do that and give up my autonomy. You can start a concierge practice. I didn't feel like that was the right fit for my practice at this time. And then you can join a hospital. That's not a great concept either, because if you join a hospital, you're paid by how many tests you order, you're paid by how many admissions you have, how many procedures you do. That's the wrong concept. The concept should be to take care of the patient. Physicians that work for a hospital are working for the hospital and taking care of the hospital. The wrong concept. What is a great insurance plan? So this is part of the problem, is the mentality of Americans today on what is good and bad with insurance. We need an independence from insurance, not a dependence on insurance. So we think that a good insurance plan is one that has a no deductible, or one that has no copay, or one that has no out-of-pocket expense. That's not what a good insurance plan is, because what those plans equal, they equal a high premium. You think, well, I get my insurance through my company and therefore it's a great plan. Remember, whatever money is paid, even if it's a high premium, whatever money is paid through your company, where does that money come from? It comes from you. That would have been your income. So don't see it as a benefit. We have to get rid of that high premium. And so to do that, we have to make a change. Mentally, and a whole concept has to change. To give you an example, with your auto insurance, if you filed for your auto insurance for your windshield wipers, for a new tire, for an oil change, your prices are going to go through the roof. That $30 oil change is going to become a $60 oil change because the insurance companies are going to make money off of it. They've got to. They got 40% of all the money you pay towards health insurance goes to the insurance and their stockholders, not to take care of you. What we got to do is raise our deductible. Make it as high as you're comfortable with, so that if you have that catastrophic event, if we have to go to the operating room, if you have to be admitted in the hospital, that you're covered. But you got to be something that you're comfortable with. And so to cover the fees, once you've got that higher deductible, is the new concept. Direct primary care, and that's where I come in to try to help save you money. You have it's a concept set up where there's a set fee paid on a monthly basis to a physician, and I take care of you. I don't have to answer to an insurance company if you need a procedure. If we need x-rays, anything I can do in the office, for the most part, all procedures are covered, most medicines are covered. This concept will save you money. So what's included in direct primary care? 24/7 access to me. You call me. If there's a question, if something's going on and you think, well, I might need to go to the urgent care or go to the emergency room, you call me. If I can keep you out of the emergency room or urgent care one time, it just about pays for this for a year. Office visits, same day. I'll have allotted times for direct primary care patients. More allotted times for office visits. If I can spend more time with you, I can probably limit the number of medications you're on. I can find your medications for a cheaper price. I can get tests done for a cheaper price. We don't have to use our insurance. Keep that concept in mind. You don't have to. They want you to think that. You don't have to. The hospital was telling a patient last week they need to get a CT scan done there for $900. Found that patient a CT scan over in Cherokee for $300. $600 saved, just like that. No copays, full physicals, EKGs, x-rays, pulmonary functions. All these tests are included. Laceration repairs, they can get real expensive if you go to the urgent care, or even in my office. If you have a high deductible, it can still be expensive if you're filing it through the insurance. Mole excisions, fractures, these can be real expensive to manage in an office setting, even in the emergency room or urgent care. Multiple seizures in one visit. That's awesome. because I hate it that I have to tell you to come back to get the x-ray on the other knee or your shoulder, when in this concept we can do it right then, no problem. No charge for prior authorizations, free virtual office visits. What does that mean? It means that your time's important too. You don't want to have to come to the office for a routine visit just to see if your blood pressure is doing okay and leave your office for 2 to 3 hours, especially if you're working downtown. We set a time, I can go online with you on the computer, we can talk. Current concept in medical care, I have to have you in the office to be reimbursed. With this, you don't have to. I'm still going to take good care of you, but I can sometimes do these things outside of the office and save you time. Significantly reduced lab costs. Through this, I've negotiated lower rates through a lab. So I've had patients come in for a physical and pay $300 or more for just their lab work. Through this, I can probably get the same lab work for under $50, saving you money. 20% off cosmetic procedures, dermal fillers, Botox, Xeomin, sclerotherapy, 20% off. These are some of the prices you're going to pay if you come to the office with a high deductible and you want it filed through the insurance. It's going to be higher rates. You don't want to pay these rates. And if you go to the urgent care or through the emergency room, multiply those rates times 2, multiply them times 4 if you go through the emergency room. This concept is going to save you money. Patients that will benefit the most. Patients without insurance, patients with a high deductible. That's a given. We've already talked about that. You know, you may say, well, you know, I'm just going to, pay the self-pay rate. I'm only seen in there a couple times a year anyway. Sure. But if you have that laceration that needs repair, if you break that arm or that foot or something that I can manage in the office, that gets real expensive real fast if you're filing it through insurance or paying self-pay. This covers that. It's like a small insurance plan. Even though this is not insurance, it's like a small insurance plan. Patients on out-of-network plans, Blue Cross, HMO, and POS, I'm not on those plans. This is an advantage. I've had patients come and say, I can't see you anymore. I have to go to a doctor that's on these plans. No, take advantage of this. The rates you're going to pay if you go to a Blue Cross, HMO, or POS doctor are going to be higher for each office visit. You still got the deductible. Until you meet that deductible, you're going to pay cash anyway. Through this plan, I'm saving you money. Patients that don't want to worry about insurance restrictions as much. Patients that want greater access to me. You need to have a question, something after hours. Instead of running to the emergency room, urgent care, give me a call. Businesses that want more predictable and lower costs. This can be a tremendous savings for businesses. There's an example where a physician, a direct primary care physician, got 50 employees out of one company on his plan, saved that company 45% off their health care in 1 year. For self-insured, small businesses, this will save you a lot of money. Another example of how to save money, health sharing accounts. This is approved on Obamacare as an insurance plan so you don't get penalized, but it'll save you money. Medishare, I actually looked at that myself. For my age, for my family, for a monthly payment with a $5,000 deductible would be $500 a month. Blue Cross was kind enough to take my 2016 rates from $1,100 to $1,600. That's ridiculous. This is going to save money. Here's a very important graph to kind of explain what's going on with the insurance comparison and understand this concept. First, we'll take the low deductible plan, the premium plan. It's $14,500 a year in premiums, but only $500 out of pocket. Now, if we take the high deductible plan, which is only $6,500 a year, but you still have $4,600 a year out of pocket. Well, let's take the high deductible plan and apply it with direct primary care. $6,500 still, but with direct primary care at $100 a month, estimated is only $1,200 a year. So let's add that with Medishare with direct primary care. $3,000 for a year for Medishare, the catastrophic, and then $1,200 for direct primary care. You save $11,000 a year. This system works, and this graph really helps explain the comparisons and the differences of what this system can do and how it can save you money. This is a great concept. What do you get with a direct primary care? Better service, better health care, lower cost. Sounds like a Papa John's commercial, but it really works. This is a great concept and what it offers, looking at the different advantages to it. So where do we go from here? If you're not interested, you can stay on your plan, keep doing what you're doing. We're going to file it through the insurance. but you may not have as easy access to me as you will if you're on the direct primary care plan. Medicare patients, I'm working on it. I know I can save you a lot of money also on this plan. I just got to get through the legal hoops that our nice government puts out there for us. If you are interested, let us know. We'll get it set up for you. Questions, call us, email us. We'll be glad to answer it. But I appreciate you listening to me. Thank you.